Let's talk about what's actually happening during a heart attack and why we give nitro. Hello, beautiful people, and welcome back to Let's Talk Drugs. So nitro, also nitroglycerin, belongs to the drug class of nitrates, but more specifically, it's a vasodilator. Your heart is a muscle, and just like every muscle in the body, it needs oxygen to function. So your heart receives oxygen from vessels called the coronary arteries. A heart attack often occurs when these vessels are blocked by a clot made of plaque in the coronary arteries. So when these vessels that are responsible for bringing oxygen to the heart get blocked, the heart is no longer receiving enough oxygen, creating the pain that you feel in your chest. Okay, cool. So how does nitro actually help? It's important to understand a little bit about how the heart actually pumps blood. So there's something called preload, which is basically how stretched the heart is before pumping blood, before contracting. Next is afterload, and afterload is how hard your heart is having to squeeze to push that blood forward. So I want you to think of it like a garden hose that is just packed full of mud. You go to turn the water on and it's just dripping slowly out the end because it's trying to go around all that mud in the hose. In this situation, the garden hose is your blood vessels, the mud is the clot, and the water trying to come out is the oxygenated blood that is trying to go to your heart. Now I want you to think about that same amount of mud that was in the garden hose and put it in a water slide. Obviously, that water is still just going to shoot through that water slide because the vessel is so much bigger. So there's a couple ways to give nitro. One of the most common ways is going to be sublingual, which is underneath your tongue. So it will be dissolved and then eventually get into your bloodstream. Once that nitroglycerin is in your bloodstream, your body will convert it to something called nitric oxide. And nitric oxide is something that is naturally found in the body, so your body recognizes it as a signal to relax the blood vessels. So this signal tells the blood vessels to relax, and once they relax, they will automatically expand, making that garden hose now a water slide. This is really important because in a heart attack, every second that your heart is not getting oxygen, there's a chance for ischemia and cell tissue death in the heart. Something that is important to mention is when giving nitroglycerin, a very common side effect is a drop in blood pressure. Blood pressure depends on how much blood the heart pumps and how tight the vessels are. When giving nitro, it makes vessels looser, which makes the heart pump less. So in medical terms, blood pressure equals systemic vascular resistance times cardiac output. And nitroglycerin affects both sides of this equation. When giving nitro, it decreases preload, stroke volume, and cardiac output. So in the arteries, nitroglycerin is going to decrease the systemic vascular resistance. And like I said earlier, blood pressure equals cardiac output times SVR. And so both sides of those have been affected in the veins and in